In the late 30s, the American War Mothers wanted to hold the community and find out what did they want to do to honor those who died in the war. And overwhelmingly, the community said, we need a new hospital. They raised $490,000 from the community by going door to door, got a federal appropriations, and were able to build the building and open their doors July 17, 1955.
The surgery are pictures of efficiency and staffed with trained personnel and equipped with the very latest in tables, lights, and the other items necessary for the protection of the patient.
Now we need to sustain the dream. With the expansion of the surgery center, we're going to be able to help all of those patients instead of having them travel out of town.
Oftentimes when patients have to travel outside of the valley for care, it is a significant burden on not just the patients themselves, but of their family members, their support system, their friends. The ability to allow them to receive that care here in the valley in an environment that is surrounded by their support system is a priority for us at TriState.
These days, surgeries are unfortunately technology heavy and require things like our robotics platform and new operating rooms that are up to date for other equipment and technology. And this allows us to do things better for our patients, faster, and ultimately with better results.
The infrastructure of our building is getting to a point that it's made some things difficult, and we're hoping that with a remodel, just to mirror what the med-surg department did, it allows us for growth, it allows us to do more surgeries, it allows us to recruit more surgeons. We want every patient to be able to come here, have their surgery done here, and not have to travel outside of the area.
In the next 10 years, 39% of our population will be over the age of 65.
As our population here in the valley continues to age, the need for surgical services just continues to grow. We've increased our surgical volumes at least 50% over the last couple of years. And, TriState was originally built in 1955 with a footprint to support a much smaller volume of patients in our surgical department.
And as they require more surgical services, you definitely want to use the best technology available for people. That requires new technology.
This expansion will be really beneficial for not only the doctors that are here, but also in recruiting new physicians to help take care of the aging population in the valley.
With the surgical expansion, it would allow TriState to offer more surgeries and new service lines.
We strive to give the best patient care. We believe that mirroring the success of our medical surgical remodel featuring larger individual patient rooms with private bathrooms would significantly enhance patient comfort and satisfaction.
I've had the opportunity to work for many different hospitals in the Pacific Northwest, and never have I worked in a community that has the commitment and the ownership of an organization like the LC Valley has with TriState Health. They show that through the support that they provide us, either in words, referrals, donations, you name it. The support is just unbelievable. And it is the reason that this organization is still here. It's the reason that TriState is so incredibly successful. It's how we draw the phenomenal employees that we have that care for our patients each and every day. It is the life of this organization.
It's not our grandparents' responsibility anymore. It's not our parents' responsibility anymore. It's our time.
It's our time.
It's our time.
Our time to support and to give and to put those same energies in.
As the CEO who has a responsibility for making sure that we are delivering on our mission in this valley, I want to thank you for everything that this community has done and continues to do to support this organization.